Good evening, everyone, and welcome to this edition of HRI Talks. My name is Garvia Bailey, and I'll be your moderator for tonight's presentation. Thank you for joining us. Welcome to the second and final session in our series on youth mental health and substance use health. If you missed part one, I would highly recommend that you go back and have a look, because these are great companion pieces. It's called Youth Mental Health Challenges and Hope, Hope for the Future, and the recording is available on HRI's YouTube channel. That session set the stage for tonight's discussion by emphasizing the need for collaboration across services and sectors to support youth mental health and substance use health. Tonight, this is going to be a great night. We will explore two innovative approaches that are improving outcomes for young people in Canada. Our expert panelists will share how these models are being put into practice across the country and what early results reveal about their potential to drive lasting change. And that's what this is all about. We have about 167 registrants to today's session, representing almost every province across Canada. So yes, high five across Canada. We're also excited to welcome a few international participants, which is always great. Thank you all for being here. Now, if you're not familiar with HRI Talks, you should know that it's about representing new ideas. It's about discoveries and studies that are helping to transform the mental health and substance use health landscape across Canada and beyond. Now, HRI works with some of North America's most influential scientists, researchers, people with lived experience, and clinicians. And together we deliver these sessions. Now, before we get started in earnest, I'd like to share that the offices of HRI are located on the traditional lands of the Anishinaabe, the Attawandaron, the Haudenosaunee, and the Métis people, and the treaty lands of the Mississaugas of the Credit. I am in Toronto, which is Treaty 13 and Williams Treaties land. I invite you to think about decolonizing your own mindset as we think about healthcare and how to care for each other. HRI supports the Truth and Reconciliation Commission of Canada's calls to action, continually working to be more inclusive in research and everyday practices. HRI is looking to promote reconciliation and healing and invites input on how to do better going forward. This is not possible without sponsors, and HRI would like to extend deep gratitude to the sponsors who make HRI Talks possible. In particular, our lead sponsor, CIBC. HRI Talks would not be possible without the generous support of all our sponsors. So heartfelt gratitude to those sponsors. Okay, now I'd like to introduce our expert panel, and they are experts. Mahalia Dixon is the project manager of Black Health Strategy at CAMH in Toronto. Her work sits at the intersection of mental health, harm reduction, and youth engagement. Dr. Tanya Halsall is a scientist at the University of Ottawa Institute of Mental Health Research at the Royal, also an adjunct research professor in the Department of Neuroscience at Carleton University, and Dr. Joe Henderson, a clinical psychologist, chief scientific officer at CAMH, and executive director of youth wellness hubs at the province's Integrated Youth Services Initiative. We're going to hear a lot about that today. So our goals for today, what do we want to get through for this session? Well, first, we want to explore the two promising approaches that I mentioned to improve youth mental health and substance use prevention. And we'll talk to Joe and we'll talk to Tanya about those specific approaches. We want to highlight real-world examples of how these approaches are being brought to life in communities across Canada. And all three of our panelists can speak so eloquently to that. And we want to examine how these strategies can drive system-wide change to better support the evolving needs of young people. And we do know from the first session that we have that young people are so vulnerable, especially in this moment. It's a fraught moment. This is a great time for this conversation. So, without further ado, let us start our conversation. And I should point out that there will be some polls that pop up, and you can this is your way of taking part and engaging you in this process as well. Some questions will come up, and then we'll just discuss your answers. It's going to take a few seconds. We're not going to grade you. We don't know who's saying what. Just take part in the polls. It's going to be the interactive part of what we're doing today, as well as a Q&A. So the two approaches that I spoke about, they're gaining momentum in Canada, and they offer effective ways to support youth mental health. One centers on delivering integrated support services, and the other focuses on substance use prevention. So let's take a closer look at each with our expert panelists. Joe, I'd like to start with you. You're in the hot seat. Can you walk us through the integrated youth services model?
Absolutely. Thank you so much for having me here this evening. Really appreciate the opportunity to connect with everyone. So integrated youth services in Canada has been gaining momentum, as Garvia mentioned, over the last few years. This is a model of service delivery that was co-designed by young people and family members, service providers and researchers to address gaps in our existing services. I was going to say systems, but many people would argue we didn't actually have a system of care. It was really an approach to working with communities to bring together all of their available resources that could support young people from 12 to 25 years old on their journey through those developmental stages, to support them around their mental health, to support them in ensuring they achieve other aspects of health, but also connections in community, connections in their social worlds. Each of these services offers mental health and substance use health services, but also primary care services, physical health care services, sexual health care services, employment and education, but also things that bring richness and quality to young people's lives as they define it and design them. So a whole wide range of opportunities for social connection, time out on the land, cooking classes, a whole wide range of services that connect young people to other kinds of supports that could help them along their journey.
That's fantastic. Thank you so much for starting us off. I want to hand it over now to Tanya to talk about the Icelandic prevention model. Can you just run us through that, Tanya, a little bit?
Sure. Thanks, Garvia, and thanks for having me, HRI, and for attending the audience. So the Icelandic model has been implemented in Iceland for a little over 25 years. And essentially, it's designed to replace unhealthy contexts where young people might be exposed to substance use, as well as the related risks, with healthy developmental contexts. So it's a community-based collaborative intervention that utilizes a population-level survey that captures data related to risk and protective factors in both the family, school, leisure time, and peer contexts. And then it uses that data to inform collaborative interventions that are intended to change system-level health outcomes for young people. So the model is best known for the trend analysis that they've collected over the years with this population-level survey, where they've impacted youth substance use in Iceland by reducing it by about 86%, for example, in terms of alcohol use and intoxication in the past 30 days. So they've been implementing the Icelandic model now internationally for several years, and in Canada since about 2019. So yeah, that's about it.
Thank you so much. That's great. It's because this is really about like taking a look at all those the best practices that are being implemented now and what can we can push forward to in the future. And maybe many of the people that are listening right now have not heard of these interventions, have not heard of these practices. So thank you so much for setting the table for that. Um, I do want to ask the audience through our first poll before this HRI talk, were you familiar with these models? Before the talk, were you familiar with these models? The Integrated Youth Services Model, were you familiar with that? The Icelandic Prevention Model, were you familiar maybe with both? Or were you familiar with neither? Okay, so it's a pretty much an even split, although most people have not heard about the Icelandic prevention model. The Integrated Youth Service Model, yes, there is some, there's about 25% of the audience know about that. About 22% know about both. And the highest percentage knows about neither. And about 8% know about the Icelandic prevention model. So hopefully by the end of this session, we will, those numbers will change quite a bit, of course. Now, both of these approaches are rooted in collaboration. They're rooted in community and youth engagement. I'm thinking about the specific examples of how these approaches are being put into practice in Canada and how young people specifically are responding, because that's who we want to reach, right? So, Joe, can I start with you and how the integrated youth services model is being implemented and what the uptake is from young people in engaging with this approach?
Absolutely. So in Ontario, we have Youth Wellness Hubs Ontario, and that's our integrated youth services that's available in Ontario. It didn't start there, though. It started with actually research, and HRI is known for its support and amplification of research and really thinking about how can research influence practice and policy. And Youth Wellness Hubs Ontario was inspired by a clinical trial called Youth Can Impact. And all that means is we used a very rigorous research approach to compare integrated youth services to treatment as usual in hospitals and adolescent psychiatric outpatient units. And we saw really good results there. And so we went on with the support of the provincial government in Ontario to expand the model into communities across Ontario, allowing us to really think about what are the things that need to stay the same in every community so that we get the results we're hoping for, but also that can adapt to each of the different community contexts to ensure we're reflecting what individual communities need. And now we actually have 32 community networks who are a part of the Youth Wellness Hubs Ontario network and delivering services to tens of thousands of young people over the last few years, with visits reaching almost 500,000 visits, but visits and numbers of young people aren't where the important information is at. We really need to understand, are young people getting the kinds of services they need and want to achieve their goals and to achieve their mental health as they would like to? And we have evidence to show, overwhelming evidence to show actually, that young people, that the services are meeting their needs, that the services are experienced in a way that has them feeling like partners in their own healthcare, and in ways that they would recommend the services to other young people. And so not only are we seeing positive clinical outcomes on functioning and symptoms and things like that, mental health outcomes, we're also providing very positive service experiences.
You know, I love that. It's the idea of being able to adapt, for that there's no one size fits all approach, and that this approach really does adapt to each community, all the needs. And I think someone who could speak very well to adapting to needs is Mahalia. working with young people and seeing how these kinds of programs integrate. Mahalia, I'm wondering about that. Examples of strategies like the ones we're discussing today, how they're being deployed, how youth are responding, and any examples of how it's working or not.
Yeah, thanks so much for that, Garvia. And thanks everyone for having me today and for tuning in as well too. Yeah, so my bread and butter, my real focus is on like youth engagement, community engagement, just engagement with folks. And when I talk about engagement, because I know that's something that not everyone is super familiar with, essentially what I'm talking about is what I like to call sometimes like the most intuitive thing in the world, right? Like we're learning where if we're going to be designing something, it's about going along with the people, learning from the people who are going to be using that thing to figure out, what we can do to make sure that it's going to be appropriate to their needs, relevant to their needs, effective, and ultimately promoting their own health as they define it. So in terms of like some examples that comes up in one for sure, like the IYS models, IPM models, I can pretty confidently say that neither of them would be as successful as they are without engaging with young folks. IYS, as Joe was talking about, Who Youth Can Impact, both projects that really center like young people, their families, and their communities. I was one of those young people as well too. Actually, I started off as a youth advisor on Youth Can Impact like way back, and that's how I got started in youth engagement as well too. And so a lot of the work that we do is really working alongside young people to ensure that we're moving forward in a way that's going to be reflective of their needs. Some cool examples of that are, of course, what Joe and Tanya are talking about here today. But one that I think is also really near and dear to my heart, and one that I spend a lot of time focusing on now as well too, and like my role with Black Health Strategy is focused on Amani mental health and substance use services for Black young folks, where with that's a program that operates across the province of Ontario, and we have an amazing Black youth advisory panel that works with young people all across the province to really co-develop our services, where young folks are involved in everything from rebranding and naming and all of that fun stuff to actually co-designing our core service model, co-designing our client journey pathway, looking through everything that we do to make sure that everything that we're putting out, everything that young people are experiencing when they access our services, is really reflective of their needs and meeting them where they're at as well too. And that expansion has been going on for about 3 years now, after about 25 years of accessing services providing services since the 90s. And it's so far been like a huge success, I would say. Like we work alongside some really brilliant folks who are becoming their own leaders in their own right. And that's one of the really exciting pieces, I would say, about youth engagement, is ensuring that young people who previously accessed services, who are currently accessing services, are informing the services that they're currently accessing, as well as the services that young people are going to be accessing in the future as well too. And so I find that, any type of project that involves youth engagement, family engagement, community engagement, is naturally like a more successful project. It's a project that is going to have less waste. It's a project that's going to have more uptake. It's a project that's going to be more relevant to folks. And it's going to have that natural buy-in as well too, and that excitement of being able to have folks be able to access services that they need, while also upskilling young folks who are already bringing like a ton of expertise and launching them forward into the next pieces of their lives as well as too.
Brilliant stuff. There's an element of that I'm going to come back a little bit later, Mahalia, and ask you a little bit about getting that buy-in from young people to actually engage with you and be part of the process, especially since you're working with marginalized youth. You're working with folks that, that perhaps haven't felt part of the process, but we're going to talk about that shortly. So let's hold that thought. I want to ask Tanya about what's happening across Canada using the Icelandic prevention model, and how you're seeing it being implemented, what you're seeing, and how our youth are playing a part in the integration of that model in places across Canada.
Yeah, thanks, Garvia. So the Icelandic prevention model now is being implemented coast to coast to coast. So initially in Lanark County, just southwest of Ottawa, and has now expanded to New Brunswick, Calgary, many other sites in Ontario, as well as the 2 territories, and from the East Coast to the West Coast. And I would say that Lanark County and New Brunswick are probably the furthest along in terms of implementation. Both of those sites have collected 2 surveys. So the population level survey is designed to either be collected annually or biannually. And in Canada, it's every second year. So in Lanark County, it was 2022 and 2024. Interventions are then designed based on what they find in the risk and protective factors. And so in Lanark County, one of the major priority issues that was identified was sleep health as it related to mental health. And then there was also safe spaces. And we've launched a youth engagement effort around the safe spaces piece because that aspect was prioritized by young people in addition to what was found within the population level survey. So in Iceland, a lot of the intervention strategies are centered around localized efforts. So school policies, creating networks across schools and parents and between families, developing policies that influence substance use, like, for example, urban planning types of policies, or it could be taxation types of policies. And then probably it's best known for the Leisure Card, which is a funding program that was created in Iceland that essentially creates high quality after school activities for all young people between the ages of 5 and 18. So outside of Iceland, there are now some pilots of the Leisure Card, which in Iceland, it's been about 25 years since they've been implementing. And when you come into school contexts, you see these sport infrastructures and youth centers all housed right around those schools. So it's not only creating quality leisure time for young people, it's also high quality childcare and lack of a need for transportation. And so these things take time to develop. And in Canada, there are quite a few communities who are looking at those opportunities. In Lanark County, our youth engagement process has been multi-level. So we've had youth at the leadership table and within the co-design of research, as well as working groups and then youth consultations. And Mahalia has actually helped out a lot with this and has been working with us since, I guess, 2023, I think it was. But yeah, and so essentially from our youth consultations, we examine mechanisms of influence based on youth perspectives, health equity issues based on their lived experience, and we also examine what the priorities were in terms of community changes. And so we've been building on that with community stakeholders since then, and we'll be moving it forward in the future.
Wonderful. This is incredible. I'm learning so much through this process, especially again, I just want to reiterate that there is this is the second part of a two-part session on speaking about this, and this directly answers questions that were brought up in the first session. So this is really, really interesting to me. Mahalia, I promise to get back to this question because I think it's so important, because both Tanya and Joe are talking about the implementation of these things and bringing youth in, and youth really driving the priorities in these interventions. So why is centering the voices and experience of youth essential in these approaches? For one, that's the first part of the question. The other part is, I know that youth, there's a natural distrust in the powers that be, the power structures that are supposed to be helping. I think that there's that trust has been eroded over time, especially in this moment. So I'm wondering about building trust to bring these youth in to the process to help to build out these interventions in ways that really matter. How do you break it down so that you do have a trusting environment for, especially, you work with underserved and marginalized youth quite a bit as well. So what are the strategies that you're using in that, and how important is it to break it all down for them so that they can, open the door so that they can come in?
Yeah, those are great questions, really hard questions, but great ones. So I'll give it a go to see what I can do. Yeah, I think that when it comes to the first one around why it's so essential, I think it really comes down to the fact that working alongside young people makes things better. It makes services better, it makes policy better, it makes research better, it makes lives better. And I think that's kind of just the reason to do it, because it makes everything so much better. And it ensures that the more healthful futures that we're dreaming of can become a reality, that they're going to be more relevant to young people, and that the young people who are currently living that reality can also take on those futures as well too. They can take on those more healthful futures by engaging with them early on and throughout the time that they are young folks. So it's really just integral to the success of anything, the success of young people, the success of programs, the success of policies, and the success of our societies as well too, as young people move into leadership roles as well. Now, the question for how to effectively engage young folks and how to support building trust is really hard, largely because there isn't really a firm answer to it. Like, I think it's one of those things that really depends on the group of young people that you're working alongside. It really depends on their histories and presence and the context that you're working within, the histories and presence of the systems that they're engaging with, the histories and presence of the facilitators who are bringing them in, like all of these things together converge to create a really unique environment that requires a really responsive approach to working alongside young folks. So I think that's always my number one thing, is that it's important to maintain that responsiveness in what we're doing and keep aware of what young folks are telling us as well too. Really considering, like you mentioned, Garvia, that like the cultural, political, economic, just overall context of our engagement activities and what young people are dealing with on a day-to-day inside of like our engagement activities, but also outside of it, to everything that's influencing their experiences that have brought them to this point as well too. One step that I find goes a really long way in ensuring that young people are feel comfortable in a space is ensuring that young people are the ones who are engaging with other young folks. So not, just like stepping in and being like, hey, this is what I'm thinking as maybe a non-youth researcher or a non-youth clinician, but having other young people with their own lived and living experiences, their own journeys and histories, positive, challenging with systems, come in and have them be the ones who are co-developing the system and engaging with their peers as well. I think that's really been essential in all of my work, as well as ensuring that we're using that peer model where young people are the ones who are driving youth engagement efforts. Community members are the ones who are driving community engagement efforts, families for family engagement efforts, and so on and so forth, as that goes a really long way in ensuring that even the questions that we bring to young people, families, and communities are relevant to them, and that we have that sort of inside understanding as well too is really important. Another piece that is so important as well too is bring that planning and intentionality as well, deep thinking, deep planning, consistently questioning as well too, like why it is that we're bringing this forward, how it is we're going to be engaging with young folks, that critical thinking, that listening to figure out more and more about what we want or what young people are telling us through the time we're engaging with them. And of course, the biggest one that we hear from young folks over and over and over again when we talk about trust is transparency and accountability. Young people often want to know why we're making decisions, who's involved in these decisions, who's funding these decisions, and what we're doing to hold ourselves accountable to what young people are telling us as well too. And the underpinning to all of this is reciprocity, ensuring that young people, like they're naturally, just by virtue of engaging with young people, we're going to be gaining so much, like systems and people and policies are going to be gaining so much. And it's important, it's integral that we're being reciprocal with that. Young people are getting even more out of it. And not just like payment, something we often talk about is ensuring that everyone gets honorarium for their work, but also thinking beyond that, thinking about how we're investing in their personal, professional futures. And that's what I found really important, especially when working alongside young people who do have that historical and present mistrust that you mentioned, Garvia, is like going that extra mile and showing that like, we're here to try our best to repair historic harms, to repair current harms, and we are willing to meet you where you are at and do whatever we can to really ensure that you feel valued throughout this process that we're engaging with together, and doing what we need to support them in those ways.
Let's keep going on the meeting youth where they're at. If Joe and Tanya can kind of expand on that within the confines of the programs that they're working in. How are your programs meeting youth where they're at so that that trust that Mahalia is talking about can be built. Jo, I'll start with you.
Excellent. And just to say, you know, every time I listen to Mahalia speak, I learn. And I have so much gratitude to Mahalia for having had the opportunity to learn from Mahalia. You know, I guess from my perspective, we need to earn trust. And it means I have to reflect on myself, and I have to reflect on what I'm bringing into spaces, what I'm bringing into interactions. And I have to step back and let others be out in front, and partnering and collaborating with all of the experts in community who have been doing this work maybe for much longer than me, or who are peers, or who are deeply engaged in meeting the needs of young people who are especially vulnerable, who have faced the harshest of hardships. We need to go to those organizations, those community partners, and find ways to partner, to learn, to ensure we're doing work that brings value back to those organizations and those young people, and to integrate, like to act on what we hear. I think a lot of, there's lots of talk about youth engagement and different things. And I think my observation over, you know, a number of years now is we fall down collectively, but especially kind of system planners, researchers, you know, all of that, service planners, it falls down when we don't come back to the people we've engaged with to say, okay, so here's how we were able to bring to life what we heard. Here's our accountability to you about the time you took to share your wisdom, the sharing, the emotional toll that it might have taken to share your wisdom. Here's what we've done with it. Here's what its impact has been. And we commit to continuously engaging with you around those things.
Amazing. Now, Tanya, I'm not going to give you a chance to answer this question because I do want to get to our audience questions. And I have another question that I want to direct right at you, Tanya, about improving services and access and how important that is. Like I said, I want to get the audience questions as quickly as we can, but I think this is an important question to throw at you. So transformative change in youth and mental health and substance use depends on shifts across the entire spectrum of care. What key changes do you see as essential for achieving lasting impact in youth mental health and substance use health? Like you said, the Icelandic approach it's been going for quite a while now, and so there should be the data is there. So what are the key changes that you see as essential to achieving lasting impact in youth mental health and substance use health? Tanya.
Thanks, Garvia. Yeah, I mean, in terms of the scale of systems change, I would say that in Canada, the Icelandic prevention model is very new. I mean, with the first survey collected in 2022, part of the challenge that I hear from stakeholders, from practitioners on the ground, is that many of our funding structures are set up in a way that it creates failure in that they don't allow enough time to create systems change, and that drives design into sort of short-term types of interventions that don't accumulate to create bigger outcomes for young people. What I see as being most important, most of my work lies outside of formal healthcare. And I would say that we need to change the way that we think about health, mental health, and substance use. We're experiencing a mental health or a youth mental health crisis. We're experiencing an opioid crisis. And both of these are population level issues. Since that's the case, we need to consider population level interventions, upstream approaches that influence social determinants of health, policies outside of healthcare, and ways to narrow the divide between the least wealthy and the most wealthy. And this will have massive impacts on health and mental health at the population level. There's some new publications coming out from Pat McGorry and Vikram Patel looking at health equity, recognizing the importance of prevention and the social gradient, and how being on the lower end of the income scale impacts our health through stress, through many other mediators. And they recognize what they call megatrends. So rising inequality, screens, well, they use the term social media, but I would say screens in the attention economy, which drives inequality again, with big tech being some of the wealthiest individuals in the world, and climate change. To address these population level health issues, we need to address these megatrends.
I'm going to throw a poll out there for our audience, and then we're going to shift to some audience questions because we do have some. So the first poll is, where do you see the greatest opportunity? Well, the second poll, where do you see the greatest opportunity for impact in your community? Is it in prevention and early support? Is it integration of youth services? Is it youth-led community initiatives? Or you can also pick all of the above. So where do you see the greatest opportunity for impact in your community? So wherever you're coming from right now, is it in prevention and early support, integration of youth services, or youth-led community initiatives? Or is it all of the above? All of the above, of course. I'm not surprised there that at 77%, everyone wants everything to come together. The prevention and early support, integration of youth services, and youth-led community initiatives all work together. And this is what I think that you all have been saying, that it has to be an approach that is holistic in nature. It has to be an approach that takes everything that's happening within the community into consideration, and then of course, that youth input. I want to move now to some questions from our attendees. Hillary Dort is HRI's Manager of Communications, and you're going to hear Hillary's voice with the first question. Hillary?
Hi, Garvia.
Hi.
Hi. I've got a few questions from our audience. So we're going to start with the high level here. One of our audience members has asked, how do we know that more youth are experiencing more mental health issues now, and why would that be? And I think, Tanya, you just spoke to that, but do we have data showing that more youth are experiencing more mental health issues now than before?
Mm-hmm. Mahalia, do you want to take that one?
I can try. Yeah, I'd also look to Tanya and Joe as well too for some of the more super aspects of it. But I can speak to some of the other pieces around like what we hear quite a bit from young folks as well too. Like my focus tends to definitely be on like what we hear from folks, what we hear from the young people that we're engaging with, and we're definitely hearing quite often all the pressures that Tanya mentioned as well too, like the different and unique challenges, I would say, that young people are experiencing right now have really converged in a big way for like the young people that we're working alongside. A lot of the impact of hearing about so many different worldwide challenges on a day-to-day basis, and while also trying to figure out who you are as a young person, are really hard things to navigate all at once. And when we're not equipped with like the coping strategies to be able to take that on, or the coping strategies to be able to navigate all of that, that really leads to some of the challenges in like mental health and substance use that a lot of young people are facing right now, and what we hear from young people on a day-to-day when we ask them about what's going on with them and in their communities.
Joe, are we seeing the numbers? Are the numbers bolstering what we're talking about right now?
Definitely. So we're really fortunate in Canada that we do have surveying that happens across the country about the needs of children, youth, families, and adults. And although in the past it's been really not so frequent, not as frequent as we need, with the pandemic, we've seen an increase in the frequency of that surveying. And so both with StatsCan and Dr. Kathy Georgiadis, for example, out of McMaster University. They have gathered extensive data on the mental health of children, youth, and families and parents before the pandemic, and then again after the pandemic. And those results show, as well as some other studies that have been done, show that young people are reporting worsened mental health. And of course, these are averages. It's not every single young person, but on average, young people have experienced a decline in their mental health, an increase in anxiety and depression-related symptoms. And within that, there are also differences amongst different groups of young people. So, for example, youth growing up in lower income contexts have had continuing high rates of presentation to hospital, for example, higher than other groups of young people. And so the point that Tanya was making earlier about the tremendous need to address inequities, not just mental health inequities, but actually starting further upstream to think about social determinants of health, structural determinants of health, and how we organize our society and the things that are required for living, and how they get distributed across communities to support all young people, I think is really important.
Yeah, thank you so much for that. Hillary, do you have another question there?
I do, thank you.
Mm-hmm.
Our next question asks if our panelists can recommend some tactics for addressing loneliness and isolation among youth. Are there things that we can do as individuals, as family members, to help address loneliness and isolation among youth?
Tanya, can we start with you?
Sure. Thank you for the question. The first thing that comes to mind is actually there's some new community guidelines that was released by Kiffer Card at Simon Fraser, I believe. And some of them are individual recommendations, but a lot of them are community level recommendations. Some of them being things like urban planning or creating policies that, flexibility at work or unions or childcare, ways to support people so that they have time and space to build their social networks is a really important piece that I think is very, very frequently ignored when we are, sort of constantly, taking funds away from social services and, placing an emphasis on, the economy and GDP. And so I think there's important elements that we can think about in terms of how we set communities up so that these supports are much more organically created and maintained.
And we do, Jo, go ahead, please.
Yeah, I was just going to say, just in case the person asking was also thinking at the individual level, being the parent of two young people myself and having observed the impact of the pandemic on themselves and their friends, I think there are a few things that come to mind, and as a clinical psychologist as well, one of the things individual adults can do in the lives of young people is also to think about their own behavior. So the time that parents spend on screen, on phone, distracted listening when someone's trying to talk to us, that can be, that's one thing. And that's one way to sort of start to think about how you are engaging. The other thing is, this is a general statement, but young people generally don't like it if we say, I think there's something not great going on here, and so let's make a targeted effort to get you out with your friends. Like that really often kind of like get some pushback. So it's really thinking about what are the kinds of things you can naturalistically do as a family, as a dyad with your young person that takes steps towards being more socially engaged. So that could be volunteering together. It could be getting out and hiking together. It could be engaging with another family, a neighbor, but bringing people together and just actually not thinking, oh, they need to be socializing with their own friends or this or that, but just get out there, get outside, engage in some physical activity, have conversation, listen when your young person in your life is speaking with you, and that will start some momentum going that could serve you well in the long term.
Mm-hmm. Yeah, I think that isolationist sort of way of being was so ingrained, and it's been very hard to shake it since the pandemic, especially. I think it's always been a thing with young people to be, come into themselves and be within themselves. But then the pandemic turned it into something that has become something that is like, I have my own young person in my life, and I think this is the thing that we struggle with the most is loneliness. Is that what you're seeing as well, Mahalia, in working with youth on the ground?
Yeah, for sure. I mean, I think it's interesting. Like a lot of the young folks that we work alongside, part of the reason why they come to us to engage is like for that social, that community aspect. That like, okay, there are other people who are also dealing with these same things. And they're interested in the same topics, and they're curious about this sort of thing. We have these different commonalities, even if we have like these huge geographical differences, even if we have these different identity differences, all of these things, like just that space is something that we often hear from young folks is like really integral to them and to their own healing, especially as so many young folks that we work alongside are also like living with their own mental health and substance use challenges, which can be isolating in and of itself as well. And that feeling of like, oh, am I the only person who's dealing with this as a young person and I don't know what's going on? And that space to be able to improve services and systems while also building relationship and building community and making friends and just having time to like connect with other people in a space that you feel safe is really huge.
I think we have time for one more question from our audience. Hillary.
We do. Yeah. Thank you. I just wanted to say thank you to everyone who submitted a question. These are excellent questions. I wish we had time to address them all.
They're really great questions, honestly.
Really great questions. Thank you, everyone. So this question came through live from our audience. They're saying, from an Indigenous perspective, youth are sacred, are future leaders. How do we walk alongside them in a good way to help grow their voices, their power, and the gifts that flow through them?
That's such a beautiful question.
Isn't that incredible? Yes.
Yeah, it's a wonderful question. Who wants to take a shot at that, at speaking to Indigenous youth and the challenges, because what we were talking about, like as we prepped for this, we talked about the fact that all of you spoke to the fact that there is challenges in each community, like there is challenges in each pocket. So integrating these models into and changing them to suit each individual challenge is so important. But can we speak? Is there someone that wants to speak to Indigenous youth specifically?
Yeah, I'm happy to speak to it. I mean, I think, one of the things I feel like I've learned is the importance of thinking from a community perspective as well. Really coming to spaces with humility and really creating space to listen and learn, and not I think you see lots of people go into spaces with their own agenda. They want to learn this, they want to hear that, they want to support young people. Like, you come in with an agenda. And I think the thing I've learned most is about the importance of stepping back and listening and following, and really offering what I have to offer, recognizing it has many limitations. I only have my own experience to offer, and offering that where I can and where it's appropriate, and then listening to learn how to walk alongside, as the audience member said, because it's so critical. Like, we just will not achieve our goals if we don't learn from First Nations, Inuit, Métis as well, in terms of how to live differently. And I think youth can really provide that. And though we have to hear when they need support, and we have something to offer that could be relevant, but also to help to support communities in being on their own journey and supporting their own youth as well.
Yeah, thank you for that. There is something to be said, like this question actually opens up the question about creating balance in voices when creating these programs. And I wonder, Mahalia, if you see that there is enough of a mix of perspectives of, because you're at CAMH, so that's coming, like, it's a very urban sort of space to be in, but there's rural perspectives, there's perspectives from all different backgrounds. How are we to go about making sure that as many voices as possible are involved in the process of creating these programs, so that it's not a one-size-fits-all approach, is what we keep saying. What are the strategies that can be used to make sure that, say, Indigenous voices are at the forefront of the creation of these programs?
Yeah, 100%. I totally agree. That's one of the biggest challenges as well, is like ensuring that we're centering young people in the way that they need to be. Like, we often talk about how important it is to make sure that young people who are made most marginalized by the systems that we're working within are the ones who are at the center of what we're doing. And that definitely can be challenging. I find that one of the most supportive ways to go about ensuring that we are centering folks is through partnership, through reaching out to folks who are already doing great work, reaching out to community members who are already doing incredible work, and like leaning on them, learning from them, connecting with them to figure out what we can do to support them. That's where that reciprocity also goes like a really long way. It's instead of starting opening an ask with like, here's this thing, please help me get young people to come over here and do my thing. It's like, how can we support you and what you're doing? And naturally, like, a partnership might flow down the line, but that's not like my motive in going into this thing. Like, I'm not trying to ask you, I'm not trying to extract something from you or from your community. I'm trying to figure out how I can support you in any way, should you want my support in any way. And I found that that's always been really important, and making sure that we're building in that time to have those like FaceTime relationships. When doing recruitment and connecting in with folks, you send a lot of emails, you offer a lot of calls,
Yes.
show up physically in a lot of places too. It's like, I'll drop in and say hi and show that I'm a real person and I care about all of this work and I want to be there to support the young people that we're working alongside. And then that's really in my experience, what's really important. And then from there, once you have those relationships, then it just spreads naturally. Like, it's once you spent the time doing that, and I'm not saying like a couple of weeks doing that, I mean years and years, spending the time cultivating those relationships, cultivating that trust. And then from there, like the really beautiful partnerships can grow from there.
Thank you so much for that. I want to give each of you 1 quick minute. The timer's on. For just about learning, and tonight is all about learning. I want to close the conversation. I'd like to each ask each one of you, what do you hope the audience takes away from them or this evening? Like, what are the conversations you want folks to leave having or talking about or thinking about? I'll start with you, Jo.
Great. Well, I mean, it's just been such an amazing conversation. I would hope that people go away and say, what's going on in my community? Who are the people in my community who are talking and working on transforming mental health, youth mental health and substance use health services in my community? And how can I get involved? What can I bring to the table? How can I support? How can I support young people in amplifying their voices? And it really is all of what we're talking about is an it really involves whole communities coming together with a shared vision of supporting young people in the best way possible. So that's what I would encourage people to do. I think that's where we can feel inspired and passionate and really make significant change.
For sure. Tanya, how about you? What do you want people to walk away with tonight? And what are the conversations that you want to spark after something like this, being able to talk about your initiative?
Well, I don't think I could say it any better than Joe. I agree that these are collective efforts, and there's so many creative, talented people who can achieve so much more working together. And it's never going to be a policy sitting by itself. It is always going to involve multiple disciplines, multiple sectors, including the public, activism, and youth. And I've learned so much from working with Joe and working with Mahalia and other folks. And so, yeah, just like Joe said, reach out, get involved. That's it.
Mahalia, last
Also
thoughts.
agree. Yeah, total ditto. Yeah, I really, I think for me, one of the big things, just investing in the time to connect with each other, connect with your young folks who are like our upcoming leaders, who are active and current leaders. It takes a lot to change different systems. It can be really hard and challenging. But engagement is a really essential component to our work. And if we want to see these systems change in the way that we know that they need to, and the way that folks outlined today that we know that they need to, we can't rely on old ways of doing. We have to, or actually we have to rely on even older ways of doing, which is engagement,
Right.
the original way of doing things. And so, yeah, excited to see where everyone will go with that.
Amazing. Wonderful. If you can believe it, we've reached the end of our time for tonight's HRI talk. And I think we've ended on a very hopeful note, a note that is a conversation starter, not a conversation ender. As we mentioned at the start, this is the final session in our two-part HRI talk series on youth mental health and substance use health. If you missed it, the recording is available on HRI's website and YouTube channel. And don't forget to subscribe to HRI Talk so you'll be able to be the first to hear about the next event, which is coming this fall. Yay, summer's coming, and then fall, we're back to it. I want to thank our panel members, Mahalia Dixon, Dr. Tanya Halsall, and Dr. Joe Henderson for taking the time to join us tonight and sharing your expertise and being so open and being just so wonderful in as conversationalists with this. A recording of this HRI talk will be shared with you and posted on YouTube in the coming week. We encourage you to share it with others who may be interested. As a registered charity, this is so important. Donations play a vital role in supporting HRI's research and amplifying impact. So if you'd like to donate, simply go to HRI's website and click the donate button. Easy as that. Thank you so much. Once again, I'd like to thank our lead sponsor, CIBC. We are so grateful to our sponsors and to our supporters across Canada and beyond for making HRI Talks possible. Of course, the audience, thank you so much. I read some of those questions. They're amazing. In the chat, you'll see some places where you can send those questions so that they can be answered in time. What your keen interest in the topic, your engagement has been amazing. I'm just so pleased that I was a part of this and got to listen to all you smarty pantses talk about a very important topic. We'll see you next time. Good night. Have a great night.